Coatesville was one of our original Montessori sites. And they, so many of their staff were trained and they had been working with the approach. And so they had already learned all of the Montessori approaches and were utilizing them and had some really neat things. One example of something innovative that they did when it comes to name tags, one of their staff had the idea for resident name tags, not only include the name that the person wanted to be called, but also their military branch, like the insignia of it. And they worked with their medical media folks to create, templates with the different branches on them. And so, and then the veterans would get their names on them. And they wore them with pride. I mean, they used them as, talking points with one another. And then we shared that idea, with our other sites, hoping that others would try it as well. So that's just one example. So it was her site that, did this wonderful thing during COVID, where the residents were able to be a part of getting Wi-Fi in their facility. And she kind of had that idea of, we need to elevate their voices. This is something that is an issue. This is something that we haven't been able to achieve. Let's get the veterans involved. And so giving them that opportunity, they were able to make something happen. And not only that, but now it's kind of rolled into more that they're looking at now establishing a game room in the CLC. And so Charlene kind of started with the building blocks of that, laying the groundwork, and they have said to her, we want another project. And so the idea is that she pull them together again so that they can share what they want in their game room, help design it, help, identify what games and what have you. So ideally, this is something that just lives on as a true resident committee, that makes decisions about how their environment is going to be structured and outfitted and, what's available to them in their environment to meet their needs and their desires. So. And you'd be surprised how many of at least our community living centers actually don't have Wi-Fi, and maybe thinking, oh, it's impossible to get that here. And yet, here's an example of somebody within the system who's been able to get it. And, it was to a great extent driven by this whole isolation. It was like, what can we do, to help in terms of people being stimulated, people having interesting things to do, content to read, content to watch. And so that was part of the driver of, we don't even have Wi-Fi. So that was, maybe that's one positive coming out of the pandemic for them, was that it kind of pushed something that they had wanted anyway and can definitely benefit from now and beyond. And I do have to give, kudos to Charlene, and I'm sure, many others on her staff, that in particular, she has such, having gotten to know her in Bath, she has such a heart for the veterans, and she really, she's very respectful of them and very interested in what works for them. I've seen her be behind initiatives in Bath as well that were very, very meaningful for residents, and wanting them to be able to tap into the things that were most important to them. And so it's not surprising that here in Coatesville, she's applying that perspective and that value, to the population that she's working with there. And helping her staff, hopefully in the meantime as well, to kind of see what can happen, how powerful that can be, when you ask the veterans, when you ask what they want, what are they interested in, give them a platform and then support them to, work towards what it is they want.